Welcome to mHealth Solutions. Your doctor has ordered this cardiac diagnostic test for you. The test will monitor your heart and may last up to 14 days. Please note that this test is for diagnostic purposes only. In the event of a medical emergency, seek immediate medical attention or dial 911. The package you received contains a kit as well as a second envelope. Make sure you keep the second envelope in a safe location. You'll need it in order to return your kit. Once you open the kit, you will notice that it contains several items. A recorder which will come with a neck strap and lead wires. A BlackBerry and its charger. Extra electrode patches. A DVD and an instruction manual. Be sure to read the instruction manual carefully as it contains important information about the test. Finally, we have included a patient survey card. If you have any comments or suggestions about how the test went for you, we'd like to hear it. We will now briefly go over how the test works. During the test, the recorder is the device that will monitor your heart. The lead wires of the recorder will be connected to the electrode patches on your body. The heart rhythm recorded by the recorder will be automatically transmitted to our cardiac center through the BlackBerry. Once we receive the data, a cardiac technologist will review it, and a diagnosis will be made by one of our interpreting physicians. The diagnosis will be sent to the doctor who referred you for this test. At this point, your doctor may want to see you for a second visit. Now let's take a closer look at the recorder. Your recorder is packed in a protective pouch. It has an adjustable neck strap and lead wires. You can either wear the recorder around your neck or clip it on your belt. Please do not remove the recorder from its protective pouch. Ensure the lead wires are securely connected to the recorder by pushing the two pieces firmly together. The lead wires have two buttons, one white and one red. Simply snap the white button on your right or upper electrode patch, and then snap the red button on your left or lower electrode patch. Turn on the recorder by firmly holding down the green button for approximately 4 to 5 seconds. You should see a display. A blinking heart will be shown after a few seconds. Now let's take a closer look at the BlackBerry. You can now remove the BlackBerry from the kit and unplug the charger. To turn the BlackBerry on, simply hold down the power button for a few seconds. Once the BlackBerry is on, you should see the following screen. As long as the BlackBerry is on and charged, it will transfer the data from your recorder to our center. There are other optional features available on the BlackBerry. You can learn more about them in the instruction manual or at the end of this video. Now that you have successfully connected yourself and turned on the recorder and the BlackBerry, the next step is to record a test. To do this, wait 60 seconds and then simply press the green button on the recorder until you hear a beep. Wait approximately 1 minute. You should hear a chime that indicates everything worked perfectly. From now on, your recorder will work automatically. However, if you feel any symptoms, such as the ones you spoke to your doctor about, please press the green button of the recorder and hold it down until you hear a beep. This will signal to the cardiologist that you felt something at the time of the recording. Keep the recorder on when participating in any kind of sporting event or activity, and try to keep the BlackBerry within 10 meters or 30 feet. It is helpful to wear a tight top and tuck the recorder and its wires underneath it. Please remember to always take off the recorder when participating in any kind of sporting event or activity that involves water, such as swimming. When showering or bathing, the recorder must be removed and placed in a dry and safe place. The electrode patches can stay on the body. Please secure the patches with your fingers when taking off the lead buttons. Once you disconnect the recorder, it will automatically turn off after 2 minutes. When you reconnect the device to the electrodes, you will need to turn it on again by firmly holding down the green button. Occasionally, you may need to change the patches. Extra ones are in your kit. Patches can remain on for up to 7 days. However, change the patches if they become loose. Do this by simply peeling off the old electrode patches and placing the new ones on the skin close to the original position. Prior to replacing the electrode patches, wash the area with soap and water and let dry completely. Please do not apply any kind of body lotions to the area around the electrode patches. It is important to remember not to touch the center portion containing the gel. Although we use hypoallergenic patches, some people still experience irritation to the skin. If this occurs, you can try placing the electrode patches in slightly different locations to give the irritated skin time to heal. When sleeping, keep the BlackBerry charged and close to you. It is best to wear a tight top to tuck the recorder and its wires underneath it. Women can wear a sports bra over the recorder and its wires. Please try not to sleep on the recorder. It is important to charge the BlackBerry every night. You should also keep it on and within 10 meters or 30 feet of the recorder. At the end of 14 days, or when we have enough information, we will call you and instruct you to put everything back in the kit. Make sure you put in the BlackBerry and its charger, the recorder and its attachments, any unused electrodes, the instruction handbook, and any other necessary belongings. Put the kit in the self-addressed, postage-paid envelope, seal it, and drop it in a Canada Post mailbox. In summary, starting the test is easy. Simply follow these 4 steps. Place one electrode patch on your top right collarbone and one on your middle left rib cage. Connect the lead wires to the patches. Turn on the recorder by pressing and holding the center green button. Turn on the BlackBerry by pressing and holding the power button until the screen lights up. Should you have any questions at any time during the testing period, please do not hesitate to call us at 1-888-636-0186. We will now go over some of the optional features available on the BlackBerry. The main menu that you see on the first screen has 3 different options. To make your selection, gently swipe your finger over the center navigation button to scroll up or down. Once your selection is made, you can click on the desired item by pressing down on the center navigation button. If you make a mistake or want to go back to the previous screen, press the button to the right of the center navigation button. The first option of the main menu is called Set up Video. Select this option if you want to watch the instructional video again. The second option is called Help. You can select this option to obtain our contact information. The last option, Diary Messages, allows you to tell us more information about how you feel during the testing period. This information can sometimes help the cardiologist when analyzing your heart rhythm. However, please keep in mind that this feature is optional. If you don't feel comfortable using the BlackBerry, you don't have to use this feature. Your doctor will still receive the heart rhythm recorded during the testing period. Also, please remember that although we receive your information and may include this information in your file, it is not monitored in real time. Selecting the Diary Messages option will lead you to a second menu. The first option in this menu is called Symptom Diary. If during the testing period you feel the same symptoms that led your physician to refer you for this test, you can use the Symptom Diary option immediately after you felt the symptoms to give us more details around the event. Selecting it will prompt you to answer 2 questions. The first question will ask you what you felt. You can select one or more options available using the center navigation button. Or, if none of the options available adequately describe what you felt, you can select the Other option. Then click Next. Choosing the Other option will allow you to type exactly how you felt using the BlackBerry keyboard. Once you're done, click Next. The second question will ask you what you were doing when you felt the symptom. Again, you can select one or more options from the list, or select Other and use the BlackBerry keyboard to describe it in your own words. Once you're done, click Next. The next screen will ask your confirmation to submit the data. If you are ready to send the information, click Submit. We have now reviewed all the additional features available on the BlackBerry. Please remember that those features are optional and that the most important thing to do during the test is to wear the recorder and keep the BlackBerry with you.